This is Sharon Bogan. We work at Public Health Seattle and King County, and we're really excited to be here to share with you what we know about text messaging and how you can use it to bridge critical communication gaps in your community.
Now, text messaging can be an incredibly powerful tool to reach communities during emergencies. But before you implement programs, there is lots to learn.
We'll be sharing with you some of our lessons learned so that you can make the most of your investment in this technology. Here are members of Public Health Seattle and King County's communication team during activation of our Emergency Operations Center. When a public health emergency strikes, whether that's an extreme heat wave or pandemic flu or a communicable disease outbreak, our role is to communicate to the public. We work to provide credible, useful information to all members of our community as quickly and as effectively as we can.
Not all communication channels are going to work with every audience. Traditionally, we have prioritized working with the media, whether that's newspapers, radio, or television. Over the past decade, though, we've relied more heavily on the internet, with websites, social media sites, and email. But a new and exciting way of directly reaching our audiences is now within our reach. The mobile phone, and in particular, SMS text messaging, is the newest way to reach the community with critical information during an emergency. One of the most powerful examples of how SMS can have an impact occurred in the moments and days following the Haiti earthquake. In the afternoon of January 12, 2010, a 7.0 earthquake struck near the Haitian capital, Port-au-Prince. Millions of people were affected by the quake, and more than 200,000 buildings were damaged or destroyed. Josh Nesbitt, CEO of Medic Mobile, talked to us about how text messaging was used to help.
So after the earthquake in Haiti, there was no 911 system or anything like it. And so we set up a short code, 4636, that anyone could text message into for free. And we went radio station to radio station, letting people know they could text their need and their location to that number. And we ended up processing about 80,000 text messages in the first 4 weeks after the earthquake. And to do that, we recruited about 2,500 Haitian Creole-speaking volunteers from all over the world who were translating, categorizing, and mapping every single one of those messages. And structured reports were then basically delivered to first responders and aid groups within about a couple of minutes after each message being received. We were definitely delivering updates on water drop points, essential sort of health tips, things like that, but more than anything, we wanted to interact directly with people's urgent needs. So it was everything from missing persons requests to food and water requests to search and rescue requests. So basically a pretty broad array of needs over the first 4 weeks or so. So like I said, there was no 911 system and just 1% of the population was on the web. About 1% of the population had access to a landline, but fully 75% owned a mobile phone. So SMS and mobile is really the only way to interact with people at scale. So in lots of ways, we are sort of following the market here. We see penetration rates for mobile technology exploding, and this is technology that is finding its way into every aspect of people's lives, and it lives in their pockets. So it's a personal technology that also scales really well. And so it's perfect for health, it's perfect for alerts, and it's perfect for anything where you need information from people themselves or delivered straight to people themselves, as opposed to organizations or other entities. And so for things as personal and immediate and urgent as health and crises, mobile is really the right platform.
As Josh Nesbitt mentioned, one of the powerful things about texting is that so many people have mobile phones. Over 300 million cell phones are active in the United States right now, which means that the vast majority of people have a cell phone. Virtually all of these cell phones are text capable. And lots of people are using their cell phones for text messaging. Texting is not a technology just for teens, though one study found that teens send an average of 50 texts per day. But about 3/4 of adults text too. The number of texts sent each year in the United States exceeds 2 trillion. The bottom line is that texting is pervasive. For many people, it is just simply the way we communicate now. Texting is also a great communication channel for reaching traditionally harder to reach communities. Unlike the internet and the digital divide, texting has been more quickly adopted by people across a wide range of language, ethnic, and income groups. For example, almost 3/4 of Latino cell phone owners use texting. And for a person on a limited income, a phone call can cost precious minutes. But depending on the plan, texting can be much more affordable. It is important to remember that many phones in the U.S. can't easily text in non-Roman alphabet languages. For the time being, you'll only be able to reach communities via text who use Roman alphabet languages, like Spanish. Texting is powerful because it's personal. People are attached to their phones. The phrase, "can't leave home without it," really applies to the relationship many people have with their cell phones. They have their phones with them most of the time and tend to read over 90% of the text messages they receive. Text messages are often more likely to get through than a phone call during an emergency. This is because phone calls require a direct one-to-one line of connection, while text messages move through the network more efficiently, using multiple pathways to get to their end destination. And our research has found that most people keep their phones on at night, making SMS a potentially powerful way to reach people during emergencies, no matter what time of day they occur.
But we're getting a little ahead of ourselves. Let's clarify what texting is. First of all, SMS stands for Short Message Service. It's also known as text messaging. SMS and text messaging are interchangeable words. Text messages are short messages of up to 160 characters in length. Text can be sent from one phone to another phone or to multiple phones. Text can also be sent from a computer application to many phones simultaneously. But what can you really say in 160 characters? Actually, you can say a lot, particularly when people aren't getting the information in other ways, when they need the information quickly and when it's relevant to them. Throughout history, some of our most compelling messages have been under 160 characters. For example, this famous quote from John F. Kennedy was only 109 characters long. Or what about this one, just 70 characters? The point is, in public health, we're used to having the luxury of lengthy fact sheets and press releases to get our message across. It's a challenge to create good but short messages, but it can be done.
If you wanted to design a public health emergency text messaging program, what kinds of messages could you send? You could send basic health and safety messages, such as information about boil water orders. These could be targeted to reach only certain geographic areas.
In a disaster like a flood, texting could be used to alert homebound, medically fragile individuals about the need to evacuate and what steps to take.
If you had established point of distribution locations for mass medication dispensing, you could send information about pod sites or reminders to take medicines.
Texting could be used to improve situational awareness with healthcare facilities. For example, Sentinel providers could text in information during an emergency. And texting might be a cost-effective way to communicate important information to tuberculosis-positive residents during a TB outbreak.
To summarize, we think texting helps fulfill our responsibility to ensure that information gets to people who need it, particularly during an emergency. It's a communication method that makes sense for many public health needs. Most people have access to phones most of the time. It's fast and more likely to get through when nothing else is working. Michael Laird, Director of Public Health Seattle and King County's Emergency Preparedness Section, thinks that text messaging could be used to great effect during a public health emergency.
Well, texting is a technology that is fairly new for public health, but it's really critical, and it's going to become more so in the future. Texting is already a tool that's used widespread throughout our communities. It's actually very inexpensive. It's used by multiple cultures. It's a tool that we can use to reach people with critical time-sensitive information wherever they happen to be at any time, which is a great advantage over things like television and radio and even internet websites where folks normally would be at a computer at some fixed location. So it's a tool that really is the future for us in how we can communicate information rapidly to people, again, across a larger community. This is how people are receiving information today. And so this is where public health and other organizations really need to be going in the future in order to get critical messages to folks during emergencies.
Before you invest a lot of money and time into setting up a texting program, you need to do market research to understand your audience. Does your audience like text messaging? How do they text today? Would they be interested in signing up for a texting program from your organization? Why or why not? You can't buy a list of cell phone numbers and text people without their permission. They have to agree to participate. This is called opting in. Getting people to opt in is a challenge, even when people are interested in the information. So even if you craft the best text messaging program with the most important messages, you need to think about how to best market to your audience to encourage as many people to opt in.
Here at Public Health Seattle and King County, we wanted to offer a program to text employees on their personal cell phones during emergencies. These emergencies could be situations such as clinic closures due to snowstorms, health and safety guidelines during disasters, or updates during crises. We conducted a survey of all employees to find out what they wanted from us. We found out that our employees had very strong opinions about getting text messages from work. Just one email asking people to give their opinion garnered 800 responses from our employees, which is a 50% response rate.
Text messaging can be a really effective way to communicate with employees during emergencies, but not everyone's going to want to sign up. Let's hear from a couple of our employees.
Emergency text messages? It's about time, finally. Everybody's texting now. We're in the modern age.
No thanks, checking my phone is just another thing to worry about.
It gives me peace of mind to know that if something goes wrong, I'll get the information quickly.
I want to get paid for my time spent on the phone. Are they going to pay for my texting bills?
It's convenient, fast, and I don't have to check email on my computer.
I don't want work to track me down on my personal phone. I need downtime without interruption.
Well, it allows me to be efficient and save time. I love it.
I can be reached the way I've always been reached. Just email or call me.
I guess we'll have to agree to disagree.
I guess so.
We addressed their key concerns in the opt-in email. We told them we'd focus only on real emergencies that affect them and would be judicious about how often we text them. Of course, we said they could opt out at any time. Texting isn't for everyone, but you can increase opt-in by being clear about your goals and plans with the texting program. People are interested in receiving emergency information by text. A random digit dial telephone survey of 400 texters in King County found that 83% of people said they would be likely to sign up for messages about emergencies. 46% said they'd like to sign up for messages about emergency preparedness. And a much smaller number, but still a substantial 26%, said they'd sign up for health tips from the health department. So while getting people to actually act on their interest by taking the time to opt in could be an additional challenge, in general, people are enthusiastic about the concept. You may want to reach people from different communities within your jurisdiction. Don't assume just because people share a particular ethnic or other type of commonality that they think the same way about text messaging. We can't assume that people are using this technology for the same reasons. We conducted in-depth interviews with over 100 people from several different communities, asking them what they liked about texting and why they used it. We used a type of audience research method called Q method. People rank order opinion statements according to how much they agree or disagree with the statement. The data are factor analyzed, and what results is groupings of people who think in similar ways about a topic. In this case, the topic was text messaging. We then give each group a name to help describe the texter type. Among Spanish speakers in King County who text, we found three main types. The fully embraced texter is very comfortable with texting and uses it for many functions. This type of texter messages friends and family daily and coworkers weekly and is very likely to sign up for text messages from the health department. The security texter uses text to stay connected with family that may be far away. Text messaging allows them to feel safe and secure in different situations, keep in touch with their families wherever they may be, and alert one another to potential dangers. The coordinator texter typically uses text to primarily coordinate their work and make plans. A typical coordinator texter does contract work and finds out about new jobs and schedules them using texting. Think about how you would use this information to develop and market your text messaging program. It'll probably be easiest to recruit the fully embraced texter to a public health texting program, since they like all aspects of text messaging. The security texter would likely be interested in getting texts to provide critical information to loved ones and to stay safe. But to reach the coordinator texter, you may want to emphasize how public health emergency information can help him figure out how emergencies might impact work schedules.
Another community we interviewed are people who are deaf and hard of hearing. They tend to be early adopters of texting technology, and many rely on it for daily communication. So they are an ideal target audience for texting campaigns and programs. Our research with the deaf and hard of hearing community revealed several types of texters. We thought it would be great to hear from them about how they use text in a game called the Texting Game.
Hi, everybody. Welcome to America's favorite game show, the Texting Game. Please welcome your host, me, Rodney Sherwood. Hey, everybody. Welcome to our show, where we make a match of dynamic demographics with purveyors of pivotal public practices. Hi-ho. Try and say that 5 times fast. This week, we tackle texting. Let's meet our participants. Texter number 1 likes to stay busy with volunteer work and rock climbing. Let's say hello to Convenience Texter. Texter number 2 enjoys swap meets and fantasy baseball. Let's have a big round of applause for Informational Texter. Texter number 3 plays volleyball and hosts a weekly supper club. Yummy! Let's meet Social Texter. And finally, he enjoys focus groups. He has your best interests at heart, and he loves keeping you informed. Big round of applause for Public Health Official.
Hello, everyone.
Gee, hi. Also, welcome our interpreter. So, Public Health, do you have a question for one of our texters?
Yes, I do. Convenience Texter. What is important to you about texting?
I like being able to get and send messages while doing something else. It's efficient, short, and to the point.
Do you feel like texting is just a fad?
Texting is the way we communicate now, so no, I don't think it's a fad. I think it's here to stay.
Excellent. Informational Texter. What do you think about text messaging?
I'm not someone to text all the time. I'd rather just meet in person. I don't text for conversation, but I do text to get or send information.
What are some examples of when texting works for you?
I text to let people know if I'm running late or to finalize plans. I also feel safer because I can text if I'm in a dangerous situation.
Very interesting. Social Texter. You must see the value in texting.
Yes, I text all the time. I'm addicted to it. I feel like texting helps me stay connected to my friends, the family, the whole world.
What kind of freedom does texting give you?
Texting is so fast and easy, and everyone in my family texts, so we keep up on news and events. Makes us all feel closer. It's a fun addiction, and texting gives me independence.
Fantastic. What I'm getting from all of you is that you use texting to stay informed, whether that's with family, friends, or what's going on in your community.
So, Public Health, how are you going to serve this gorgeously diverse group, huh? Will you send occasional preparedness alerts to texter number 1? How about random health tips to texter number 2? Or perhaps friend requests to texter number 3?
Rodney, I think I can best meet all of their needs if I focus on what's relevant to their community. By sending out emergency alerts only on topics that would directly affect these 3 texters and their community, I think I can get them to opt in. And that means increased access to critical information.
Texters, are you ready to meet your public health official?
I'm so excited.
I don't blame you. Hi-oh, have at it. Well, there you have it, folks. Another happy union between common sense and community. Until next time, bye-bye, everybody.
Uncovering all the various uses of text messaging is important for several reasons. First, it shows the diverse ways people use this technology, including to access information and to communicate when they need help. For some people, it's a true lifeline that public health organizations cannot afford to ignore. Second, knowing something about your audience helps you market your texting programs so that you can reach as many people as possible with critical health information. For example, if you were marketing to deaf and hard of hearing individuals, you might include in your materials appeals about how it provides peace of mind. Another approach would be to emphasize how they can get information directly to their phone quickly and to keep them safe and secure. A common thread across all the people we've talked to about texting is that they want personalized, relevant text messages sent on a limited basis. You're entering your subscribers' private space when you text message them. Make it count.
We've talked about the importance of understanding your audience. Now, to get to actual implementation of texting programs, it's important to understand a few things about the technology and the way it works. You can either send a text message from one phone to another phone, or you can send messages from a computer-based application to many phones all at the same time. If you do this, you'll need to work with a vendor who will help you make this happen. Either way, it's interesting to know what happens to your text message as it makes its way through the telecommunications infrastructure.
It may seem like magic when you enter a text message into the system and moments later it appears on hundreds of end users' cell phones. Our technology expert will explain what really happens when you press send.
Hi, my name's Logan Kendall. I've been working for the past couple of years with the Public Health Department looking at how you can use text messages in emergency situations. Have you ever wondered how, every day, millions of messages are traveling all across the country, and they manage to do it without placing any real extra load on the system? And that's what's neat about text messages. So if I pull out my phone, I jot out a message, click send, what happens is it goes to the nearest cell tower. From there, the network will look anywhere in the country where my friend is, pass it along to the closest cell tower to her, and from there it travels over the air and she has the message in a matter of seconds. Very easy, done. So that's how a normal phone-to-phone kind of text message works. But let's say I have to send out 10,000 messages with an emergency announcement. I can't just do that from my phone. So what I have to do is work with companies called aggregators. And what aggregators are is they have dedicated connections with all the carriers. So what I do is I go to my computer, I jot out the message, and I click send. And I send that along with all the phone numbers I want to reach out to. And the aggregators will then figure out for each phone number where the message needs to go to and push that out to the carriers. And from there, it works like any other text message. That's the general gist of it. Text messages can be pretty impressive. I can be roaming, I can be driving across the city, I can be even offline, and a text message is still going to be able to reach me.
SMS vendors are companies whose role it is to facilitate sending mass numbers of messages to your public. They manage the first part of the life cycle of a text message before the message hits the carrier network. Typically, vendors will provide a web-based application that allows you to manage your subscriber list of end users and then send messages right from your desktop. You log onto your computer, select the group of people you want to text, schedule messages, and receive reports. There are a variety of vendors out there, and each of them offer different services at different price points. Some vendors specialize in marketing, others focus on emergency alerts. One of the things the vendor should do is help you decide what type of shortcode you need.
A shortcode is a 5 or 6-digit number, like a phone number, that is used for sending mass text messages to your audience and receiving messages back from your subscribers. There are shared and dedicated shortcodes. Shared shortcodes are used by many different agencies and companies. A shared shortcode is less expensive. Dedicated codes may be better for some purposes, but they are more expensive. And speaking of costs, the industry is still in its relative infancy, so costs are all over the map. They can range from several hundred to several $1,000s per month. This depends on if you want a package deal that includes thousands of messages, if you're going to pay per text, or a combination. The more messages you send, the cheaper it is per text. And if you want a dedicated shortcode that your agency alone will use, tack on $1,000 more per month for that code. There are cheaper options available. But we have learned that similar to other industries, you tend to get what you pay for in terms of reliability, customer service, ease of use of the system, and more.
We've put together a list of questions that can help you along the way towards selecting a vendor. Questions range from how secure their system is to how much experience they have with the carriers and their cost structure. The FAQ is available on our website. Stay tuned for that website address at the end of this video. Using a web-based interface to manage lists of cell phone numbers and to send text messages is a lot easier than you'd think. Sharon's off-site to show you how easy it is.
Sending large numbers of text messages to your community from a local health department is fairly easy to do. I'm going to give you an example. You can log on to a texting system at home, at your office, or anywhere where you have internet access. Then you type your message and send it to the people who've opted into your program. During a public health emergency, you can send text messages to large numbers of people by logging onto the system, typing in your organization name, writing up your message, which I've already done here, selecting your group that includes the people that you want to reach with your message, and hitting send. It's that easy. There's also a function to be able to view reports of the messages you've sent, as well as an inbox where you can view the messages coming back in to the health department. It's fairly straightforward and easy to do. There are a variety of different vendors, so you have to do your homework to figure out which vendor is going to meet your needs best. They have different features at different price points.
You have identified a communication gap that text messaging should fill and confirm this by doing audience research. You've set aside a budget and carefully selected the right vendor. You've figured out how to get subscribers to opt in and how you're going to market your program. It's time to write your messages. We're going to tell you about a recent pilot we conducted that will illustrate some of the messaging challenges you might come across. This is an image of a mass vaccination clinic our department held to provide free flu shots to our residents. Some children needed 2 doses of flu vaccine. We knew that there would be a challenge in getting kids to return for the second dose. We could have handed out a reminder card, but we would have run the risk of it being thrown out or forgotten. Calling or sending a letter was just too expensive. We thought that text messaging would be an ideal way to remind parents when it was time to get their child a second dose of vaccine. It would be timely and personalized for their child. We wanted to minimize the number of texts we'd send parents while making the message as clear as possible.
Here's the message we wrote. It's been 30 days since your child got their flu shot at the health clinic. Here's your reminder to get them a second dose of vaccine. Call your doctor or pharmacy for an appointment today. We liked this message because it was personalized and highly relevant to the parent. It was clear what the purpose of the message was, and the action step is also clear. It all fits on one text message. We checked with our compliance and legal office just to make sure it was okay to send. We were advised not to send the message because of the federal HIPAA law, which protects people's healthcare information. The problem was that we wanted to text protected health information, or PHI. The reason it was PHI is because the message mentioned a second dose of flu vaccine, implying that the child had received a first dose of vaccine, which is information about a child's health care. Sending protected health information over text messaging is unlikely to be a problem from the privacy standpoint under HIPAA, as long as the parent agreed to receive such private information. SMS is not mentioned specifically in HIPAA. However, text messages may be considered electronic, and HIPAA has special rules for the transmission of electronic information. One concern with electronic transmission of PHI is that it could be intercepted by an unauthorized person. Currently, there are many unknowns about the security of SMS technology. One thing is sure, SMS is not 100% secure. Risks of interception might take place anywhere along the pathway from when the message is sent to when it's read by the end user. If a healthcare provider wants to send PHI via text, the security rule under HIPAA requires analysis of the risks of interception and other potential problems associated with electronic transmission. In order to send PHI via SMS, an agency would have to do a thorough analysis of all the risks and come up with reasonable and appropriate alternatives to mitigate them. It may be up to individual agencies to determine what are reasonable and appropriate mitigation alternatives. Compliance and risk managers are likely going to make conservative judgments every time because their job is to protect your agency from liability. But policymakers will likely weigh the public health benefits from the potential risks of liability.
We rewrote the message for our second dose pilot to get rid of the protected health information. We developed a two-message solution. The first message read, "Keep your children protected against the flu. Some kids need a second dose 30 days after they receive their first flu shot." This first message was designed to trigger parents to think about the flu vaccine. The second message said, "Do you remember asking for a text message reminder for flu vaccine? It's time. Call a doctor or pharmacy to schedule an appointment." This second message prompted parents to remember that they had wanted a text message reminder. In our opinion, the two-message solution isn't as good as the original because it isn't personalized. It's less clear and could annoy some parents because we sent two messages when one would have been better. Remember, whenever possible, send fewer, more customized messages. Clearer messages will enhance your credibility and make it more likely that the recipient will act.
So how did it go? At our mass vaccination clinic, 84% of parents whose children needed a second dose of vaccine opted in to receive text messages from us. We believe this high opt-in rate shows that we provided a service that people wanted and valued. It was easy and inexpensive for us to provide the service. We had an overwhelming number of parents sign up to receive a second dose text reminder on their phones. Let's hear from them about why they signed up.
I signed up for the second dose text because my schedule is so hectic and it was during the holidays and I didn't really want to have to remember another thing. So I signed up for it and I knew I wouldn't have to open any mail. It was so convenient. When I came back from vacation, I got a reminder on my phone and I was able to make a call right from there and sign you up for your second dose.
Mi hijo va a la guardería y siempre hay niños enfermos ahí. Para mí es muy importante saber que mi hijo está protegido. Recibir los mensajes de texto fue súper sencillo y el costo fue nada. Yo lo haría otra vez.
You know, I'm already getting text reminders from my doctor and my dentist, so for me it was a no-brainer to get text reminders from public health also. It's a great customer service and I'm pretty confident that I'm not going to get any spam from them, so I would definitely sign up again.
In the event of a large-scale public health disaster such as an anthrax attack, our agency will be even more prepared to help people stay on track with their medicines and ultimately will make our community healthier and safer. This is the power of text.
So what can you do to get started? We think it starts with communication and audience. Find out what communication gaps you have and then determine whether text messaging can fill those gaps. Be prepared to work with leadership in your department because text messaging is relatively new to public health delivery. Like all communication methods, there are costs, so don't waste resources by starting out too big. Finally, copy down the website address we'll share with you at the end of this video. Please contact us and we'd be happy to help where we can. Let's hear one last voice from the field. Richard Adler at the Institute of the Future sums up why you should think about mobile technology and SMS text messaging to improve and protect health.
Well, there's a couple of reasons why mobile is a powerful platform for improving health. First of all is its ubiquity. Virtually every adult in the United States and about half of the population of the entire world now have a cell phone. And there's no other technology in history that has ever been as far-reaching. And in addition to that, not only does everybody have it, but cell phones have a couple of characteristics which make them particularly appealing for health applications. One is that they are personal. People have individual cell phones that they're very attached to. They carry them with them all of the time, and so they're connected to the greater world. And so if you want to intervene with people, you want to communicate with them in their lives at key moments, the cell phone is really the only technology that lets you do that. And finally, these devices are getting more and more intelligent about I think 25% of Americans now have what are known as smartphones, Androids and iPhones and BlackBerry type phones, and these really let you deliver more sophisticated applications. So you put all those together, you really have a very interesting and powerful new way to reach people in the world. The most powerful way of delivering a mobile application today, or the most effective, is by using simple text messaging. I mean, the fancier smartphone apps may look, kind of sexier, but the great power of texting is that it's very simple to do, and it reaches 95% of all phones. If you're developing an application for smartphone, you have to worry about, does somebody have an iPhone? Do they have an Android? Do they have a BlackBerry? In the case of SMS, virtually every phone is capable of receiving them. And I think the key thing to keep in mind with all of this is it's really not about technology, it's about people. You really want to look at the population you want to reach, the message that you want to deliver to them, and then figure out the best medium. And mobile, I think, increasingly it should be one of those alternatives.
So that's Texting 101. We think mobile technology is a very powerful tool to connect communities with the information they need to promote and protect their health.
And while no one communication method is working for everybody, text messaging is right for many. It can be a low-cost, effective, and efficient way to deliver public health emergency information, as well as everyday health programming.
We hope you've learned a lot from this video. Feel free to contact us at our website.
Thanks for watching.